For today's video, I'm going to be talking about 6 common concerns of mothers during the postpartum period, namely shivering, perineal pain, cramping, lochia, urinary retention, constipation, and hemorrhoids. Shivering is a very common complaint presenting in 25 to 50% of normal deliveries. In order to stop shivering, use heated blankets and appropriate clothing. If the shivering does not resolve, contact the anesthesiologist as it may sometimes be due to the anesthesia. Perineal pain is a very common complaint, especially after vaginal delivery. To treat perineal pain, use ice packs in the first 24 hours, following by heating pads, or you can use sitz bath 2 to 3 times per day for 10 to 20 minutes. And if you have severe pain, NSAIDs may be used. Cramping is another complaint due to very strong uterine contractions and is often more severe if you had 2 or more pregnancies. To treat cramping pain, NSAIDs are usually taken and cramping spontaneously resolves by 1 week postpartum. For lochia, patient education is needed and you should explain to the patient that lochia is usually the blood you see after normal delivery, and this bleeding can last for up to a month. Contact your doctor if you find that the lochia is foul smelling. Hypotonic bladder and urinary retention is another complaint. It is common and is usually due to neurologic injury where the patient has difficulty voiding and has increased urinary frequency. To treat urinary retention, Kegel exercises can be done. You should first urinate to empty your bladder and contract the pelvic floor muscles. An example of this is telling your patient to pretend you are trying to avoid passing gas, or pretend to tighten your vagina around a tampon, and hold for a count of 10. Relax the muscles for another 10 counts and perform 30 of these contractions, 10 times sitting, 10 times reclining, and 10 times standing. Constipation is commonly seen due to normal changes, including decreased GI tract motility. Hemorrhoids often precede delivery but are worsened with longer vaginal deliveries. Both are self-limiting conditions and can be treated symptomatically by drinking lots of water for adequate hydration and by taking stool softeners.